So Dr. Traver earned his undergraduate degree, graduating with high honors in biology from Boston University. He was accepted early in his undergraduate years into the molecular medical curriculum as a Commonwealth Fund Scholar, and in so doing, earned entrance into Boston University's School of Medicine upon graduation. After receiving his Doctor of Medicine, he completed his internship and residency in pediatrics at Boston City Hospital, now known as Boston Medical Center. Following this, Dr. Traver served as a physician for various international relief efforts throughout Asia, including the Philippines, Vietnam, and Cambodia. It was in Phnom Penh where he and his wife helped start the internationally acclaimed National Teaching Hospital, the Sihanouk Hospital Center of Hope. After returning to the States, Dr. Traver worked at a large managed care medical group where he served as volunteer clinical faculty for Stanford University School of Medicine. It was during this time that he became aware of friends' children who had been diagnosed with autism, and he soon became deeply interested in this set of conditions. Subsequently, Dr. Traver spent 2 years at Stanford University Medical Center's Division of Child and Adolescent Psychiatry. There, in the pervasive development disorder neuropsychiatry and ADHD clinics. He became familiar with the treatment and management of individuals with autistic spectrum disorders and ADHD, utilizing psychopharmacology as well as performing individual assessments as part of the clinic team. Dr. Traver is going to talk to us about his research findings on autism. Please welcome Dr. Traver.
So I want to thank Susan Downs and SVHI for having me here. I've been able to be part of some of the presentations here for a few occasions, and it's always very interesting. It's inspirational. It's very thought-provoking. I was last here, as I was sharing with some friends of mine here, with Dr. Sihanouk from Harvard, who did a phenomenal job, and as many of you may recall, he's the gentleman who He's a gentleman who started the research on leaky gut, which of course was laughed at for many, many years. And I guess nobody's laughing now. Do I just keep going here, or am I? Oh, should I hold? All right. Well, let me start with a few questions here. Who knows somebody with autism? Okay. And let's roughly ask this. In 1980, did you know anybody with autism? Raise your hand if you knew somebody in 1980 with autism. Okay. Anybody know what the current prevalence of autism is as we sit in this beautiful room? Yes?
2010 is 1 out of 68. One study shows 1 out of 42. 1 out of 38.
So that's 2010. Anybody know about today?
1 out of 42.
Yes?
My understanding is that it's 1 out of.
Oh, sorry. Oh, I'm sorry.
My understanding is that it's 1 out of 32 or 31, depends on, and in Korea it's 1 out of 31, according to what I just read yesterday.
Okay, all right. So you're certainly more up to date than I am, if that's the case. It was a trick question because as we sit here, nobody knows the prevalence of autism today. Our stats are basically founded on the research that was done in the most recently from 2012. So what we currently quote as what is accepted now is typically 2012. Even though, and as many of you know, you cannot get data collated and synthesized in the year it's actually drawn. And that's the problem. We don't know what it is today. But when I finished medical school at Boston University, it was 1 in 10,000. It was 1 in 10,000. I graduated medical school in '85. Well, thank you very much. So I'm going to try to punch this out. I have a quick disclaimer that anything that I talk about here is not supposed to be considered professional medical advice. Get that, of course, from your own doctor. And the few things I'll be talking about at the end are not standard FDA agents for autism, and we'll tell you why. And this is where we are. A few years ago, it used to be 1 in 88. And the startling statistic is that autism, even then, carried a greater prevalence than all of the different conditions combined at that time. And it was about 1,000% increase over 40 years. That is from 2012, but the irony is actually that stat is from 2008. So in 2008, which is when this information was actually compiled, it was a 1 in 88, although no one says that, because what most people don't realize who don't follow science, they don't realize that the year something comes out, it's already old. And that's where we are with this tragic set of conditions. This is the rise from Autism Speaks. I don't know if you can tell very much of the figures. It's a little hard to read. But as I think Susan shared, in 2010, it was 1 in 68. And a lot of people want to know, well, maybe this is just that doctors got smarter. Because, you know, we're all smarter than the old doctors. And that's really good to hear. I'm not sure if that's the case. But Robert Bird from UC Davis, who is a well-known epidemiologist, has debunked that fact, as well as Tom Insel, who was the NIMH director. Many of you have probably heard his name, and he actually said in 2011, by quotation, this is a bona fide increase, and we need to focus on the environment. In 2014, another predictable study came out, and that yielded a similar stat of 1 in 68 prevalence. Male-female ratio changed a bit. Now males are growing up to be a little bit more disparate than the females, and it's now almost 5 to 1. There's the 1 in 42 parsed out to 1 in 189 for women, for girls. And in the UK, it's about 1% of the population. In Ireland, it's about the same, although it's not up there. Korea, it's actually Young-Shin Kim, who used to be at Yale and is now at UC San Francisco. I had the privilege of talking to her. It's about 1 in 38, and that's pretty high. That's over 2.5% of the population in Korea. And the reason it's so high, and it was starkly different than what had prior been published, is that oftentimes these children were not diagnosed, they were unrecognized, and had not gotten treatment. In 2014, the NHIS showed that it was actually 1 in 45, and that's a 2.24% here in the States, not in Korea. And this came out of a parent survey from children ages 3 to 17. Over 12,000 parents were surveyed on this one, which is quite large. And it's pretty much similar actually to the 1 in 50 prevalence reported in the 2013 National Survey of Children's Health telephone survey done collating the data from 11 and 12, all right? So the 1 in 45, 1 in 50, definitely more frequent than 1 in 68, are not new figures. They actually are similar. Michael Rosenoff, who is the epidemiologist and the director for public health research at Autism Speaks, actually says that this is really not surprising, and I actually agree with him. If anything, if you would talk to any of the authorities who deal with autism, it's usually considered to be vastly underreported for a variety of reasons, and that's important to know. This year, just about a month and a half ago, the CDC's Morbidity and Mortality World Report estimated 1 in 68, and again, that comes from 2012. That's currently what's accepted, and this comes out of the Autism and Developmental Disabilities Monitoring Network, ADDM, and basically it hones in on 8-year-old kids, and really goes down to the medical services that they're provided, medical educational. Of course, that leaves a great question if kids are not getting the services that they're supposed to have are they reported, and that's probably a great discrepancy between what is real and what may be on paper. And these come from 11 different states, and we can go into that later if you want to know what those are. So if you want to know how much this actually costs us, this is pretty phenomenal. It's last year it was about $268 billion. In 2025, Paul Lee, professor of public health sciences at UC Davis, this is not made up by me, estimates that it'll probably be about $1 trillion. And conservatively, it'll be about almost $500 million. So this is quite significant. I'll tell you why. If you compare it to Alzheimer's, does anyone know the prevalence of Alzheimer's right now? Any guesses? Yeah.
2 to 4 million Americans.
One in how many would you say?
25% over age 85.
Yeah, it's actually 1 out of every 9 people greater than 65 in America now have Alzheimer's. 1 out of every 9. Do you know how much money that takes right now? That took us last year $236 billion. Look how much this is. This is very concerning. Even if I didn't care as a doctor what's going on, from a purely financial perspective, this is shattering. Okay, we'll talk more about that maybe down the road. What can we do about this? We look at something called translational medicine. Translational medicine is the average time. This is a kind of approach in medicine that appreciates that the average time it takes to get something from research bench to patient bedside, if you will, is almost 20 years. That's phenomenal. So what we're just discovering now in our research labs will be available probably in 2033. That's significant. And a lot of my parents don't understand why when they read things on the internet, they're desperate for help. Anybody with a chronic condition, anybody who suffers, is not willing to just go by the double-blind, placebo-controlled trials in the bastions of the ivory towers. They want help now. That's certainly understandable, and I'm thinking pretty reasonable. And one of the reasons is because there are many roadblocks, and some of these are that the research, oftentimes the clinical settings will refuse to test the research that is being generated, and basically it takes quite a while for the proven interventions at one small study to become standard practice on a community level. That's one huge hurdle that has to be crossed. So what can we do? We can identify MRFs, and those are factors or facets of illnesses that can be treated, controlled, modified, changed, and through which effective benefit can hopefully be rendered. These are just definitions from some of those sites, UMass, UCSF, and that's what we're going to try to use tonight. What's our role? Our role is to recognize the relationship between maternal preconception, that of course means before the woman even gets pregnant, prenatal factors, and possible postnatal treatments. We're going to try to make that bridge tonight in a little bit. And then we want to try to see if by some stretch of the imagination we can mitigate risks of this set of conditions by offering evidence-based anticipatory guidance, testing, and treatments from preconception all the way through postnatal life, and then we'll scan 5 different periods for that. Has this ever been done? Well, let's take a look at something called the Foresight Program, and this comes out of England. And this was done in the late 90s where almost 400 couples, basically at high risk for some of the things you're looking at here, were chosen. LBW means low birth weight, by the way. SIDS, of course, means sudden infant death syndrome. And they were given counseling, and basically they removed toxins, which is pretty bohemian, because in medicine we're really not taught much about toxins. We're taught how to spell the word, and then we move on to more important things, of course. And they removed heavy metals, and I think we just mentioned EMR, and electromagnetic radiation stuff, and pollution. And they treated a few things like allergies and parasites. Very nice.
What is EMR?
Electromagnetic radiation or electromagnetic frequency. And basically, despite all the chips quote unquote loaded against them, they had an 89% successful birth rate. 175 out of 204 true births came forward despite a history of infertility, no miscarriages, deaths, or any of the other items that you're looking at. Quite phenomenal. Most of the women were 22 to 45 years old. The men, by the way, were 25 to 59. Okay, that's an overall 86% success rate. And here are some of the stats. You can look at them yourself. Pretty phenomenal. Look at the average, predicted average for UK, United Kingdom couples were miscarriages 92, stillbirths 5, low birth weight 33, malformations 11, and if you look at the right column, 0, 0, 1, 0. Pretty phenomenal. To be quite candid with you, the relatively minimal amount of invasion they did in terms of offering some level of prevention. I'm not saying that, I'm not disparaging, I'm very happy they did this, but compared to what we're talking about today, this is fairly conservative. I'm very enthused by this, and this should be a good, omen for all of us. Question.
Was just the mother treated, or the mother and the father?
I would like to lie and say I know that, but I do not know.
That's a really
I
important factor, and to get the zeros, I could see you could get.
I do not know.
I won't interrupt.
That's a great
you.
question.
Talk more.
I have to get my legal pad out and write that down. Okay, good. There are 5 periods we're going to travel through with brisk pace tonight to look at really the factors that have been observed to be associated with an increased risk for autism. And the discussion of the postnatal, that rust-colored word at the end, will focus on observed abnormalities in the context of treatments. So let's start our motion forward. So women, before they even decide to get pregnant, we now are recognizing that some women are going to be at higher risk for having a child with autism. And this comes through nutrition. And this comes through, nutrition, by the way, isn't, did you eat 2 Big Macs or did you eat a tofu burger? Nutrition has to do with biochemistry. The American Journal of Clinical Nutrition, AJC, is a very gold standard #1 journal. It's very hard to get an article in that. So, of course, we were not taught anything about nutrition in medical school. We were taught during the 2 days that it did occur that it was probably worth 2 days. And so what we see here, and there's a lot of information I have in my lecture notes, but the bottom line is that for women who carry a reduced folate carrier gene mutation, a point mutation called the SNP, single nucleotide polymorphism, there's an increase in autism risk with a variant up to 46% increased risk with a GG variant. And the DNA of these women are hypomethylated, which means that they don't have the right carbon transfer, and there's abnormal gene silencing and abnormal gene activation. They have reduced methylation capacity. They had elevated compounds like S-adenosyl homocysteine, adenosine, homocysteine. They're not bad compounds, but in excess, they are not good for us, and they can be predictors of inflammation and other bad juju. Maternal genetics and epigenetics, therefore, may influence fetal predisposition to autism. Well, how about preconception and age? The risk of spectrum disorders increased significantly, 30% or more, with each 10-year increment in maternal age and paternal age. So even before a woman gets pregnant, not that you can modify a woman's age, but in the sense of if a woman wants to know when should I get pregnant, is there any risk in me waiting, they probably should have some of this data on hand. What they decide to do, of course, is their decision, and it has to be respected, but without them knowing, I don't feel comfortable with that. And to this point, advanced maternal and paternal age are independently associated with increased autism risk. And this came out of a Kaiser study from 95 to 99, looking at almost 600 families with autism and about 130,000 families without. So that's very robust. Then they did another study looking at advanced, for preconception age, looking at paternal age. And Israel, by the way, has done some great studies on this. Advanced paternal age is independently associated with an increased risk of autism. Men over 50 were over twice more likely to have a child with autism than those who are less than 30. And that controlled, by the way, for maternal age, which is important. Preconception and immunity. So this is a big, big topic, and this comes out of our backyard at UC Davis. And I'm going to tell you of one of my favorite researchers, and that's Dr. Judy Vandewater, who herself is an immunologist at UC Davis. And there's a study, and she was leading a team, and this actually, the primary name on this is Braunschweig. And this study came out in 2013 and was part of what's called the CHARGE study, where in this case, almost 250 mothers of kids with spectrum were compared against about 150 moms of kids who are typical. And they found something absolutely astounding. They found that the women, 23% of women who had autistic children had circulating within their blood up to 7 antibodies that were directed against fetal brain tissue. To attack fetal brain tissue. And the specificity of these markers is almost 100%. Maternal reactivity to any of the 7 antigens individually or in combination was highly significantly associated with the spectrum outcome in the child. The odds ratio on that was 3.2. When combined, 23% of these mothers of children on the spectrum had a combination of autoantibody patterns containing 2 or more of the target proteins, and the statistical significance was, and I know you're not in the numbers, was p less than 0.0001. That means it's incredibly significant. And this is absolutely astounding, because what it shows us is that there is a placental transfer of maternal antibodies. This is now the largest subpopulation of autism known in research, something called maternal antibody-related autism, MAR autism. It's not only associated with an increased risk for autism, but also with greater severity of autistic symptoms. And in another study, they transferred some of the serum of these mothers into primate models, and this is all, you can look at this online, the primate models actually started developing autistic behaviors. So it's very fascinating. And they ran more and more scores, and we can talk about that in more detail. But this is something that's very important, because right now they are in the steps of trying to develop an assay to offer women who've had one child with autism and are still interested in having another child or having more family. And this is something that, of course, is very challenging, but they're in the midst of that. You may not know this, but autism risk is greater for those children conceived in December through March than those conceived in July. And this actually is very commensurate with the risk of schizophrenia. So if you look at the research done at Columbia University in New York, if you look at the work done by the work at UC Davis, you'll find that the risk, if you want to know the percentage risk, I will take you from November, it's 7% increase. December is 9%. January is 8% increase. If you have a child in February, it's a 12% increased risk for autism. And then March, which is in red, is a 16% increase if you decide to have a baby then, if that's the time of conception, not the time of birth. Yes? And as some of you may guess, we'll tell you what the theory behind that is, but that may be asked right now.
So you are talking about conception?
Yes, I am. Time of conception. Can anyone guess to why this correlation might exist?
Vitamin D.
That has certainly been tabled, but that is not the primary thought that circulated initially about this.
Light in the eyes, because of how it affects the mother's brain, therefore affecting the fetal brain?
I don't laugh at anything. It's a possibility. Actually, the reason people are thinking this is correlative is, and they've done some work on this in the East Coast, is exposure to viruses. And maternal exposure to viral infections, not that women have to be dead and dying, but that they are exposed. And thus, as you can tell, this is obviously the winter cold area, flu season. So we'll talk about this. This research came out of 98 to 2008, just FYI.
But this has always been the case. And why are we now seeing this problem?
Right, so it's not just about viruses, is it? It's also about the substrate, which is the body of the woman, and that's where we're going to go next. Some of you heard of this, the time of conception between pregnancies. So here's the whammy. If you're born, if you decide to have a child less than a year from the time you've just had a child, the chances of having a child with autism increase threefold. And if you have a child in under 2 years, it will increase twice. And this came out of a Columbia University in a 92 to 2002 study looking at about 660,000 children. Peter Berman, who did this along with Chestak Pastova, said this is a really robust association. I certainly don't disagree. But of some note, by the way, it's not related to preterm birth, low birth weight, and it crossed all socioeconomic and demographic categories. And what you'll find with autism is that, unlike other conditions, it seems to be impervious to anything sex, race, socioeconomic condition. It's everywhere. And so we have a lot of work to do, don't we? Yes.
I have a fundamental question.
Yes.
I have a fundamental question. I see the data, but from our experience, my experience, autism is not, it's not like seeing cancer. I mean, it's not, at least I don't believe that there is a specific test that can be conclusively, looked at and said, okay, yes, the child has autism at age 8 or whatever age you want to do. So all the statistics is great, but then I'm going back to trying to figure out how do they know if there is no test, or at least in the time that this was done, back in the 80s, there was no test to determine what autism was. I think today there's a lot more information. So how do they determine all these statistics from something that is sort of maybe autistic, maybe not? Is the child autistic or is he not?
Sure, it's a good question. It's a good question. So a few things. Number one is most of these studies are this is from 2015. So the criteria are very well established. It's still a clinical criteria. And we're going to get to one of the pillars of your question, which is there any test? And the reality right now is there still remains no universal test, but some very, I would say, frightening things that are about to be shown in the later part of my presentation have appeared on the horizon that deserve some attention. So that's why I introduced the MAR autism. The specificity of that is almost 100%, and that's phenomenal for almost any test. And I dare say even the pregnancy test, as women know, isn't 100%. It's tragic when a woman thinks she's not pregnant and it is, or she's not, or it is pregnant and she's not. But that actually occurs as well in what I would call kind of the gold standard in terms of being known in the community. But good question, and we'll get there. So keep that in mind. So the timing of conception between pregnancies, this kind of just goes over it. This is from Osni Zerbo. And I spoke with him personally. It's very interesting. If you look at the second bullet point, it says that even after 6 years, I believe it's 6 years, you still have up to threefold increase of risk for autism, as opposed to if you're in the window between those numbers. So there seems to be a nadir, doesn't there, in which, at least statistically, you might be able to mitigate risk. No one clearly understands why. By the way, there's a lot of theory about this. Some people think a woman's body is now depleted of nutrients. That's why you can't have a baby too close to another. Again, in the old days, whatever we're referring to, we had 25, 10 kids, 12 kids. I mean, it just is really a different world. And now we're saying don't have another one in a year. Clearly, some things have changed. And it's not just, as you say, one factor. Does anyone know what that is? Any guesses? That's right, that's IVF. That's IVF. That is a future baby with some help. So the use of assisted reproductive technology, ART, is associated with double the risk for autism. It applies to women mainly less than 35. This came out of Berman a year ago. And he looked at 6 million children born between 1997 and 2007. And it might be modifiable if you limit it to single embryo transfer. There's no significant increased risk for single births, and that's nice. And I've also spoken with Bob Navio of UC San Diego, who's a major metabolic expert in mitochondrial conditions with autistic individuals, and he agrees that the risk is probably about 2 to 3 times. It's 4.5 times the risk using ICSI, which is used in about half the cases now of assisted fertilization. This comes out of a review of about 2.5 million birth records between 82 and 2007. That's at 25 years. Unfortunately, the overall risk increased also for intellectual disability, aka mental retardation, and that goes up to 50 to 70% increase with this. So that's not a great number, but it is interesting to know that one expert at Sheffield University, his message is, overall the message is a positive one, suggesting that any risk of these disorders is very low or absent. So I don't know exactly how he gets that, but that is his statement. I'm glad that he thinks that. So a pause as we move from one phase to another and go environment versus genetics. In our own backyard, Joachim Hallmeyer at Stanford, I had the privilege of getting to know him a little bit. He basically did a phenomenal study, and that was about 5 years ago, showing in fact, and this is the seminal work that demonstrated that environment plays a greater role than genetics, which up to this point was never officially allowed to be said. So his work was quite, like everything else, it has to be duplicated, or like everything else, it has to be reproduced. But the conclusion is susceptibility to spectrum disorders has moderate genetic heritability and a substantial shared twin environmental component. Okay, let's keep going. Let's go to prenatal. This is going to be robust. Pregnant women diagnosed with a bacterial infection during hospitalization have a 60% increased risk of a child with ASD. Any kind of infection, GYN infection, urinary tract infection, or amniotic fluid infection, all of them count. And if it's in the second trimester, they have a 3-fold increased risk. This came out of a 95 study to 99 study where they examined 400 autistic individuals and 2,100 typical. Yes. Yes.
And my recollection of that time period, going back to the 80s and 90s, probably now, when anybody gets any kind of that, not loud enough?
No, it's the people at home.
They can't hear.
Hi. My recollection of how bacterial infections were treated is with antibiotics, and lots of it. You had to have a minimum of 2 weeks straight antibiotics.
Right.
So it could be a correlation with bacterial infection. It could be a correlation with the amount of antibiotic that's in their gut.
Okay, now you really got me going here. So is anyone familiar with what just came out of St. Jude's? St. Jude's Hospital? This is important for all of us, not just women, but they are the ones with the amniotic fluid. So I'm sorry, men. So St. Jude's just showed that the first exposure that a baby has to bacteria is actually not in the vaginal canal. It actually can be through the amniotic fluid, because we found out that when infections occur, actually some of the different components called LPS, lipopolysaccharides, are able to get through the placenta into the baby. What's really interesting about her comment is that the use of certain antibiotics actually are used to kill bacteria by lysing the cell wall of bacteria, and what those do is they fragment the LPS, make them more available to these children. Very, very interesting. Yes, go ahead.
But we already know that Lyme disease is transmitted transplacentally. So what are we really looking at? If there's an epidemic of Lyme disease at the same time, I have many clients who've transferred it to their children, and their children are always on the spectrum in some capacity.
The idea of transplacental transfer is certainly becoming more and more appreciated, and I'm going to say something to that. Something came out of, now it's called Augusta University in Georgia. I don't know if anyone knows this. So schizophrenia, I know we're not talking about schizophrenia here tonight, but I'm trying to pirate some of the information from other paradigms. It's about 1% of the United States, schizophrenia, okay? About 1% of the population will experience relapse, right? If they have a urinary tract infection, that goes up by 29-fold. And if anyone knows of the work done by Alan Brown at Columbia, his work has been phenomenal because it shows that perhaps up to 1/3 of human beings with schizophrenia have this due to a viral infection that occurred when they were in utero. Very interesting. We'll talk about that some more. I'm just going to move forward because of time. Maternal hospitalization for viral infection in the first trimester. Watch the trimesters, 3-fold increased risk. How about bacterial infection in the second trimester? 1.5-fold increased risk. This came out of the Danish studies from 2005. Very interesting. This is a book I often show my mom and dads. This is called Infectious Behavior by the late Paul Patterson. Phenomenal book, absolutely phenomenal. Maybe 150 pages, very much worth its weight in paper, and I would ask everyone to look at this. For those of you who know about the 1918 flu pandemic, it destroyed I don't know how many millions around the world, killing people across the globe. Those who were born from the time that they were gestating in the mothers during the flu, you may know they had higher rates of physical disability, heart disease, diabetes, and out of this came the concept fetal origins of adult disease. And some of you are aware of the Dutch hunger winter when the Nazis occupied Holland. The Dutch take meticulous records, one thing the Dutch do, and they found that in the winter of 1944, there were extraordinarily high rates of obesity, insulin resistance, and schizophrenia of those who were born from that period. Very interesting what nutrition can do in the adult, all the way back to the child. Well, here are all of us, and I was just ill actually a few days ago, and here's a woman looking discouraged because she probably has a fever. And lo and behold, any fever from any cause doubles your risk for autism. And in a similar way, developmental delay, DD. When you compare that population to those who don't take any fever medication, this came out of UC Davis Mind, and this is from 2013. This study came out of collated data from 03 to 10. And they didn't specify necessarily what antipyretic, but let's talk about that. Some of you know about what this is called. It's called acetaminophen, and has many different names. I'm not going to try to name that here because I'm not necessary. And this study came out of University of Oslo in Norway. And lo and behold, they found with this large cohort of children, maternal use at different weeks actually showed 4% of moms using this at least 28 days during their pregnancy. And that's a lot. That's a lot. And the children that were born showed everything that you're looking at in the final bullet point, which is very discouraging. Now, does anyone know the study that came out last year from the Ohio State University? What did that show? Yes? Anyone know?
Is that the one with Tylenol and the vaccine?
This is the one with, I'll just use the word acetaminophen, and emotional recognition. And Durso and his colleagues showed that by using the same compound, that people, they're not pregnant, by the way, these are adults, actually when given this agent, were blunted in their response to both positive and aversive stimuli using a picture test. And that's theoretically because one brain region that this compound works on is called the insula, and that, of course, is a region of the brain that deals with emotions and pain at the same time. So it may be emotionally blunting as well as pain blunting. Interesting. Type 2 diabetes, gestational diabetes, high blood pressure, obesity, more common than controls among mothers, and the odds ratio is 1.6. Developmental delay, the odds ratio is over twice. And of all things, diabetes is associated with greater deficits in expressive language. And this came out of UC Davis, 2012. Let's look at diabetes and prenatal obesity in tandem, because these often travel together, not just independently. Look at the number of mother-child pairs were studied in that time period. And what they found is that the hazard ratio of this occurring for pre-gestational diabetes is almost 4 times. So you have a 4-fold risk of having a child with autism with these factors. And if you have obesity and you have gestational diabetes that comes on when you are pregnant, usually that occurs, by the way, around 24 weeks. It can occur earlier or later, but that's roughly the time. You have a 3 times the risk of autism. That's phenomenal. We were talking about vitamin D earlier. So I don't know if some of you are aware, China did a phenomenal study with vitamin D at Jilin Hospital, and they gave a young child 150,000 units of vitamin D intramuscularly, followed by several thousand, I think 5,000 every day, and that's phenomenal. And the child made drastic turnarounds. I'm not saying he was cured, but vitamin D is used for multiple sclerosis, and it's used for quite a number of things. It also is imperative, and I tell all the women I know this, it's imperative for women to have their vitamin D above 50, if at all possible. It is possible, and to have it checked. And you have to, if necessary, find a physician who will be willing to do that, because most physicians are not going to offer that to you. They will not offer you monitoring. They will offer you one vitamin D test, and then they'll say that's enough.
You can actually get vitamin D tests through, what is it in Florida?
Directlabs.com.
Yeah.
Awesome.
$49.
Well worth it.
Sometimes cheaper.
Even more worth it. Vitamin D, multivitamins, low folic acid, low iron, and carnitine, all risk factors for autism. I'm not going to go into all the studies. I have a lot on my subscript, but something to look at. And it's interesting about low folic acid. We'll talk about that, because a study came out, and this was just presented in Baltimore, Maryland last weekend, at the International Meeting for Autism Research, that high folate levels in women after giving birth were exposed them to a 4 times the adequate level, doubles the risk of autism. Isn't that interesting? And if a woman has high B12 in her blood 3 or 4 days after giving birth, she also has a 3-fold risk for autism. Both levels extremely high, put it to 17 times the risk. That's not a good number. I have a lot to say about that, but I have a hand, so go ahead.
RBC levels or serum?
As far as I know, they were serum. Sorry.
Yeah, please wait for the mic. I'll get there as soon as I can. Thanks.
Sorry. I'll wait too. All right.
We do want to hear what you have to say about that, though.
Well, we can talk more, but one huge area that has been investigated, and we'll talk about this when the slides come, is the idea of oxidized versus reduced B12, oxidized versus reduced folates, and we'll talk about that in a little bit, hopefully. But I want to keep moving down. Let's talk about stress. No woman who's giving birth or carrying a baby should be under any stress, of course. But here's one where they looked at Hurricane Katrina and what they found, and they did a very elegant study in terms of the geography of where the people were, and this is from New Orleans, Louisiana, how close they were to the epicenter of the storm and other issues, financial issues, et cetera. And they found that after ranking different parameters, autism prevalence increased in dose response with the severity of the commensurate storm. And there was a disproportionate increase in the middle and the end of gestation, which is interesting. Now, what occurs when you have stress? Does anybody know?
You deplete B vitamins.
You deplete
Cortisol goes up.
cortisol. What does cortisol deal with? What's that?
Blood sugar resistance, diabetes, sugar.
It has to do with the metabolization. It has to do with metabolizing your fats and your sugars.
These are all of the right answers. I'm going to cheat and give you the short version, which is inflammation. But it has to do with inflammation, and that's correct. and immune system stress. That's right. This also came out recently, and this is the prenatal use of antidepressants. And any use of any antidepressant studied during the second or third trimester increased the risk for autism by age 7. And specifically, the focus of this is the use of selective serotonin reuptake inhibitors. And that increased the hazard ratio by 2.1. That's very concerning, and the risk remained after considering maternal depression, which itself can be inflammatory. So that's unfortunate. This came out of a study out of the University of Montreal and examined about 150,000 singleton full-term births, so that's quite a number. Here we go, psoriasis. So psoriasis is a risk factor for autism. However, in this study, other autoimmune disorders didn't seem to yield that, but psoriasis did, which is interesting. The other one that yielded a positive correlation was allergic rhinitis, asthma and allergies, so that's kind of interesting. One thing also interesting about kids on the spectrum, when allergy season comes, they have a pretty tough time. And it usually is something probably correlated with the activation of their immune system. This is anecdotal and only, it's not on the slide, but I thought it'd be interesting for you to hear. Does anyone know what terbutaline is? You know what terbutaline is? Terbutaline is used in birthing of women. Terbutaline is used to slow down labor. Terbutaline is used in the ER. Our ERs, when a woman goes in with premature labor or contractions, they will often give her terbutaline. And then they'll send her home once the contractions are under control, possibly with oral terbutaline. This is related to something called albuterol. If you know what that is, that's something we use for asthma. It's a rescue agent. And it exposes something to the body, something the B2AR, which is the beta-2 adrenergic receptor. And it overstimulates that receptor in this research, which is very interesting. This is by Lisa Krohn. And this was done at Kaiser from 95 to 99, published in 11, and basically showed that there was a 4-fold risk independent of any indication of use, which is very interesting. And this did not include the use of any other kind of tocolytic or other agonist. Moms of kids with autism and ADHD had significantly higher mean chemical intolerance scores. And chemical intolerant, 3 times more risk for autism, almost 2.5 times more likely to have a child with ADHD, and the association with multiple chemical intolerances and ADHD and AD existed in the offspring. Does anyone know what imidacloprid is? It's in just everything we have in our, right, Fido and, Kitty have it here. And so work out of UNC Chapel Hill has shown that use of, the flea and tick collars have their risk factors as well. Does anyone know what that is? That's probably my home state of Illinois. I used to be proud to live on a farm and all that, but I don't know about this anymore. You know what that is? Yeah, well, I can't say that. You're a brave woman. Does anyone know what? You know what that is? Yeah, someone's home. They're living next to this. That's pretty phenomenal. That's phenomenal. The UC Davis Charge study, 970 families, 60% increase if any exposure, any time of the pregnancy. How do you like those apples? 3rd trimester, risk doubles. 2nd trimester with chlorpyrifos, 3.3. For those of you who don't know what that is, that was a pesticide banned from residential use years ago. It was banned, so we can't buy it, but it's still used in our crops. Yeah. Very interesting, isn't it? I could keep going, but I'm going to just for time. Prenatal PCB exposure, I think you can read there, affects behavior, learning, memory, and language. Basically what PCBs do, which are in all of us now, I don't care who you are, man, woman, old, young, they're in all of us. They're in Antarctica. They're in the seals. It hijacks our calcium. And does anyone know the recent article out of Harvard came out about a month ago by Martha Herbert? Phenomenal article. She and Yao Wen did a phenomenal job on this. Basically shows that calcium signaling, calcium receptors, and protein kinases are essential to autism after looking at all the different metabolic pathways and the genotypes. Occupational exposures, looking at the lacquers, look at all the different multiple risk factors, lacquers, varnishes, xylene, solvents, asphalt. These are all come up from the 2012 study in Journal of Autism and Developmental Disorders. Pretty much self-explanatory. Of course, none of us are exposed to this.
Nail polish.
I didn't want to say it. Neural autoimmunity and air pollution. Mexico City metropolitan area. Calderon and Garcia-Duenas did a great study on this, showing that basically air pollution loosens your blood-brain barrier and creates holes in your BBB. And then as that happens, it also starts making autoimmune antibodies to your brain neural tissue. So I thought you might like to know that. And these trigger that autoimmune response that was also seen in Parkinson's and Alzheimer's in megacity children. How about where you live? Of course, we all live in an apple orchard away from the highway. In this study done, and I think, oh gosh, I'm looking here. It was 2003 to 2009, and this is also from the CHARGE study at UC Davis, and they showed that people who lived within a mile of the highway increased risk for autism. And the intrapartum period was about 1.8, and the third trimester specifically was over twice the risk. So I always ask my mothers who come to me with their children, where were you living when you got pregnant? That's what I want to know, okay? Some of you may have seen this. This has now become legendary. This is the study out of the Johns Hopkins group and the Kennedy Krieger group in Baltimore, Maryland. This occurred in 2005, and this is led by Diana Vargas and now a very prominent neurologist, Carlos Pardo. And in this study, they showed, this is a watershed work, showing glial activation, I'll tell you what that is, ongoing neuroinflammation, and abnormal inflammatory molecules floating in the blood. We'll talk more about that. There's on the left side, in a rat, normal cortex. On the right side, that's the cortex after traumatic brain injury. And that's where the glia, the immune cells and the Butler cells and the kind of nanny cells of the brain that help the neurons thrive and, kind of homeostasis there, come in large, activated, angry, and they are on fire. There's a 23-week-old fetal brain culture human astrocyte, a kind of glial cell. And here's what they found in these 11 subjects post-mortem, ages 5 to 44. And that's interesting that if you notice I said 5 to 44, because what you're looking at now was seen in the majority of the specimens. So what we seem to be observing now, based on the Vargas study, there seems to be an ongoing neuroinflammatory state in patients with autism in some undefined population. So you go, well, what's the point of you saying that? That's not very good news. Well, the good news in that is that it's not like a stroke where you have a damage done and it's over. I mean, we're not going to recover from stroke that we know of yet. But with autism, what seems to be an avenue of approach is that there seems to be something that's being perpetuated and rolling. And if we can somehow abort or mitigate that inflammatory cycle, we have a chance for improvement and possible repair. So all this on here it's self-explanatory. The microglia, the astroglia, everything seemed to have some level of abnormal on-fire state. The one on the left side is the normal neuron. The one in the middle is moving toward autism. And the one on the right is, and that female also I believe is autistic patient. She is also autistic. If you look, I'll have to use my hand. If you see this right here, folks, the little wisp of a hair, red thing, that is all this. That's all glia. And that is an activated glia cell that is very, very angry and very unhappy, and that occurs with radiation, it occurs with meningitis, it occurs with traumatic brain injury, it occurs with autism. It occurs with any neurodegenerative disease. Glial activation is a bad sign. We don't know if it's a normal response to something. No one's going to be so brazen to say this is the key to autism, but that is clearly not a typical resting state of the brain. And of course, the neuron itself is quite degenerated. What's the conclusion? You can read it. And the hope is to invoke therapies that modify the responses to the brain. And that's why I work with anti-inflammatories in my practice. Well, here's something, and I'm going back to this gentleman's question, which was good. He asked, well, would we have any real tests? So there were three things I wanted to look at. One was the changes in the brain, and the last thing you would think of are changes in the lung. There's a woman named Barbara Stewart, and she looked retrospectively at bronchoscopies that were done between 2009 and 2011 in Phoenix. And what she found for children who came in with chronic cough, recurrent wheezing, bronchitis, aspiration, so maybe some congenital anomalies, and who are autistic is the following. They had normal upper airway anatomy, but the lower airways, after the third generation of bronchial tubules, had double branching. And I'm going to show you what that means. And there was never been described before. This is what this is. There's a doublet. So you go, what's that? I'm sorry, the quality, but. So when you branch, when you have a bronchus of any level, the tube goes down, and then typically there's a bifurcation. It's not supposed to go down and then go down in parallel fashion. And what you have here are two tubules coming from this large one going straight down versus bifurcating. This has never been described before. Do you want to know when this happens in embryological formation of the human being? Between the 3rd and the 16th week. 100% of the children who had doublets were autistic. It's never been described before. I've been in touch with Barbara. Phenomenal finding. You go, well, how would I know if my friend's children who has autism would have this? You'd have to bronch them, obviously. What if they don't have the chronic cough or the things? I don't know. But my point in sharing this to this gentleman is it's becoming clear that the road signs are not pointing toward you get autism after you're born. The road signs are have risk factors preconception and prenatally. And I'm arguing that we start paying attention to this so we can make a difference, because in my uneducated opinion, and I'm not an expert. I'm a clinician. I'm not a researcher. The only way we are going to turn the tide of this tragic set of conditions is by prevention. It will not be by after all these kids come out, then we start doing something about it. It's just not going to happen. And that's why I brought up finances, among other things. We're not going to have the money to do that either. You know what this is? That's actually a placenta. So this is the third example to help answer this gentleman's question. That's placenta, and that's something, the dark blue right there, those bunch of grapes, that's something called the trophoblastic inclusion. A bunch of cells that usually comes out in the placenta that usually indicates something is going wrong. Something is stressing the baby and the mother. And the trophoblasts normally provide nutrients to the embryo to facilitate implantation and to develop in a large part of the placenta. They're the first cells to differentiate from the egg. Look what they found at Yale. Harvey Kleeman in 2013, 3 years ago, and Cheryl Walker at UC Davis built on an earlier work from 2006, and they used the marble study at UC Davis to show that trophoblastic inclusions likely reflect altered early developmental processes. And when you had more than 2 TIs, trophoblastic inclusions, I'll use the word TI now, 8-fold increased odds of 2 or more TIs for autism. And some of these placentas showed 15 TIs. 2 or more had a sensitivity of 41%, but a specificity of 92%. As I said, TIs are not just for autism. 4 or more TIs predicted almost 97% probability of autism. Kleeman's now using this as a test. 5 or more predict an infant at risk of 99.6 probability. Yes. Go ahead.
So they don't have to.
How do they test for the TIs?
They look at the placenta.
So a woman is
Once the
pregnant
baby's
and they
born.
do,
Once the baby, this is a postnatal test.
so they cannot do this through, what do they used to call that stuff? Amniocentesis. for
No,
example.
no, this was done postnatally. The examination, through the examination of the placenta. So, but I'm just letting you know this because as you already could tell, this is not a postnatal issue. This didn't come out after the baby was born. This has been going for months. And like the lungs, nobody seems to pay attention. So we still think autism is a behavioral issue. Ladies and gentlemen, I'm telling you that autism is a behavioral issue, but it also pervades virtually every other organ system that I have found in my practice. Hearing, eyes, taste, GI system, immune, it goes skin, it goes on, and it is universal. It is legion in its manifestations. Let me keep going. And I think I showed that to you. And this came out last week. Acute phase proteins, so elevation of certain proteins made by the liver when there's inflammation, and look what happens. The odds ratios are 0.8 to 1.4 autism to controls for elevation of these proteins. Males are higher than females. So the idea is that on day of life 4, when children have those heel sticks in our newborn nurseries to collect for newborn screens that every state in our country mandates, like sickle cell anemia and thyroid and everything else, this group took a punch of 3 millimeters and went down into that little bloody thing and got their little 3 millimeter punch and looked at it and found elevated inflammatory proteins. Isn't that interesting? On day of life 1 through 4. But these kids look normal. They all turned out to have autism. Or the ones with the higher risk factors, rather. And oh, by the way, I did want to show this to you. A lot of them had third trimester infections, and they were also at risk if they had lower APGAR scores. And APGAR scores, of course, talk about how robust the child is when they come out, color, cry, tone, that kind of thing. Let me go on. How about Pitocin, women with Pitocin? Induction augmentation, cervical augmentation, misoprostol, these sort of things all have their risk factors, 23%, 10%, 15%. If it's augmentation only, for female babies, 18%.
Is that
Yes, I'm
an
sorry.
18% increase for female babies if the mother has been given Pitocin?
Yes, for augmentation, for just augmentation. Cervical
But the
augmentation.
Pitocin's used routinely in
So,
hospitals. And
it
what
is.
I'm hearing, whether it's male or female, this is significant.
So there's a lot of data out on, there's a lot of controversy on this one, and there are studies out that refute this, and there are studies that support it. What the main concern I have to tell you is that a sudden rush into a woman's blood of Pitocin, oxytocin, disturbs what is theorized to be a wave-like or pulsatile release of oxytocin, which is physiological, the rhythm, and people fear, I'm just telling you the fear is that it downregulates the Pitocin receptors in the fetus through a traumatic onslaught of synthetic Pitocin. I'm not here to say that's right or wrong, I'm just giving you some background. I'm going to move forward. I'm sorry, I'm not trying to. Okay. Prematurity, I think it speaks for itself. There's an elevated hazard risk of over 3 times if there's extreme premature births, and that was from Sweden. That was in 2013. I'm not going to spend too much time on that because I think it's pretty intuitive that prematurity carries its own risks. So what are the potential treatments for targets for treatment in the last 3 or 4 slides? Methylation, oxidative stress, which is related to inflammation, neuroinflammation itself, and oxytocin dysregulation, which we just mentioned. And these are chosen because these actually relate back to what we've discussed are abnormal markers in women identified for increased risk prenatally and preconception. Jill James from the University of Arkansas is now well known as one of the national leaders in methylation chemistry, as well as Dick Deeth from Northeastern. And this study that comes out of Jill's group showing that oxidative stress is higher in infants with autism. It's higher, methylation support is needed through methyl B12 injections or methyl B12 support in some method. Reduced folate agents like folinic acid and 5-MTHF. And this goes back to something somebody said about I'd like to know. So the question I have, of course, for the group that did the work, and it may have been Hopkins, I don't remember, that issued their study last week at the IMFAR conference, is for women who in the first 4 days of life or so showed higher B12 and folate acid levels, is that actually oxidized folic acid or reduced folic acid? I want the breakdown. Because what we do know about children with autism, before we try doing all the weird stuff we do with giving B12 and methyl B12 and reduced forms of folate, is that their B12 is already very high. And it's abnormally high, so what's happening is probably that they have oxidized forms of B12 that are not being integrated into the biochemistry. That is probably what's happening. And we do know that already that there seems to be, as identified again by a number of people, including Richard Deeth at Northeastern, there seems to be a folate trap. And this is why, a number of you already know this, for nutritionists, it's now being called into deep question whether women should get folic acid in their prenatal nutrients. Rather, shouldn't they be getting reduced forms of folate? And that's a big issue, because what if women cannot change folic acid to the reduced form, which is the biological form that is used in the human body? Then you have what's called a glut of folic acid, but water all around, not a molecule to drink. Okay, so that NAC, some of you have heard of NAC. This is what we give to girls who try to kill themselves in the ERs by taking too much Tylenol in their suicide attempts, and we put a mask on them, we give them a mist of NAC. And what that does is it rescues the liver from the destructive effects of Tylenol. Well, guess what? NAC, Antonio Hardin, and many others have done studies on NAC, and it shows that these children actually can improve their irritability. There is some level of improvement socially as well. And so I use that, and the method of madness in this one, and it appears to modulate glutamate levels, which can propagate oxidative stress and propagate inflammation. And this is all over the counter. That's what's nice about this. It's not, hoity-toity, NIH medicine that you can never get a hold of. And it has some score improvement that I showed you. One of the final things here is memantine. I know the last thing you probably want to put in a kid is an Alzheimer agent, but this is an agent that actually helps modulate that glutamate, among other things. It's an uncompetitive antagonist. And actually, this study was almost unreal. Ches did this in 2007, and it showed a 70% improvement in language and socialization when you give this agent. I do not get that anywhere close. But in my patients who it does help, it is incontrovertible. It is real, and it's amazing. So this is something that we can hopefully offer to our patients, because what appears to be happening in Alzheimer's patients may also have a common thread in children on the spectrum as well. Yes?
Is this pharmaceutical something that needs to be taken for their lifetime, do you know? Or is it like a 6-month pulse, and then their socialization is normalized enough that they can continue on? And of course, if they've gained language skills, that'll...
Great question, and the answer to that is remains unknown. I usually keep my kids on for 3 to 6 months and try to draw off at that point. And most of the time, I get some level of retention of gain, which is good. Yeah. And I'm going to close out. Yeah, I'm sorry. Go ahead. I'm trying to.
How is memantine administered?
It's oral. It's oral. It's either in a tablet or in a liquid.
Can you get a prescription for that from a doctor? Do you need a prescription?
Yeah, it's a prescription agent now. By the way, it's a lot cheaper than it was a few years ago. It just lost patent a year or 2 ago. By the way, you want to hear something really freaky about this? I haven't put on the slide. You know what this is really? This is a modified form of an antiviral.
Say that again.
It's a modified form of an antiviral medication. So when a child responds to this, in my mind, this is my practice only, they are now mentally a candidate for looking for viral presence and possible antiviral medications, which I have some of my children on. Yes. And I'm going to finish out here because I want to.
How long does it take to notice some improvement?
on this
that's
in general? Like 2 weeks?
No, that's a great question. So the improvement usually is noted within the first 2 weeks in my patients. I'm not saying they arrive, but mom noticed something. And unless moms want to pay me to lie to me, I think they have a bigger issue than their child with a spectrum disorder.
Because that makes a lot of sense if it
right.
helps with viruses, that you'd see an improvement in 2 weeks.
It was a weak agent in that regard, so they found another use for it. And I'm going to the last one is, you guessed it, intranasal oxytocin. So this is what they use for oxytocin. For full disclosure, comes out of a mom's pituitary, right? And when she has breastfeeding, and when she shakes the hand, and doing other very socially intimate activities. And basically, oxytocin is used to help recognize social cues, helps with an anxiolytic. It helps recognition. It builds trust. A lot of different things, and maternal attachment. And so they showed in some of the studies, and this is one from 4 years ago, that INO given twice a day for six weeks had some improvement after that time for social cognition and quality of life. Nothing in the immediate outcome, but after 6 weeks it seemed to offer benefit. In my children, mostly boys improve rather than girls. That's my personal anecdotal feedback. Karen Parker at Stanford has done great work with this, and she's also working with vasopressin. UC Davis has done some work with this as well. This is a wonderful nasal spray. You just have it compounded up the nose and you're done. And we see how things go, and usually the response is within 2 to 3 days. So it's nothing too long in terms of waiting. And the final slide in this sense is prevention. I think by color coding you can see where I've gone, and I won't belabor you by reading that. You can see for yourself. The idea is to try to access some of the markers that we've noted are increased or decreased in the preconception or prenatal phases, to try to offer a woman, and a man for that matter, some mitigation of risk for an outcome that is untoward. It's that simple. Bob Navio, who I mentioned, this is one of my favorite quotes, and he said, "We have to boldly go forth with imperfect information and still try to understand the world." And that's really true. And that's hard because in medicine, we often try to think that we know it, but we don't know it. We just don't know. But we can be honest with each other and say, well, let's try together. And that's it. Thank you very much. Now, do I take questions? Is that what I'm supposed to?
Yeah.
Okay. Oh, here.
Go ahead.
Sorry.
Is that on?
All right. Yes,
Okay.
go ahead.
First
Go ahead.
question.
Regarding the MAR antibodies,
Yes.
Number one, why are they in the mothers? Because we're seeing autism now. We didn't see it before the 1980s in general, speaking generally. So how can a whole population of women all of a sudden develop antibodies, and we'd want to know why? And the antibodies you said were to fetal brain tissue. Were they also to the mother's brain tissue? And if they're specific to the fetal brain tissue, I'm wondering how that could be possible in one generation to have created a whole new version and whole new type of antibody in the human race.
I will tell you what I do know. I try to get hold of details of the study more. Nobody knows why they're there. Okay, nobody knows why. Presumably, I do not know if they're only to the fetus or the mother. Presumably, the only thing I've read, study after study, was directed toward fetal brain tissue. No one mentioned maternal brain tissue. I will tell you that.
Do you know if the mothers had any other autoimmune disease, like rheumatoid arthritis or perhaps MS? That I'm wondering about undocumented, unrecorded autoimmune diseases that the mother's experiencing prior to birth, and then the birth and then pregnancy decreases the immune system, and then it goes wild. Autoimmune diseases, by definition, are dysregulation of the immune system, and I think in effect we know very little about them, how they work. And
Absolutely.
You put that in conjunction with the changes in the immune system that happen during pregnancy,
which are also very little understood. And I'm going, what's going on?
And the answer is I don't know. I don't know. Those are great questions, and they are currently being investigated. No, I do not know. I mean, that's why I said I think UC, yeah, yeah, it is. It is the largest cohort that we know of right now.
Get on. For the case of an adult, any suggestions or an approach you might suggest for neuroinflammation?
Well, you've asked a mouthful. I think the devil is in the details, isn't it? So the question is not all neuroinflammation is the same. And it's not just neuroinflammation per se, it's what kind. Is the neuroinflammation associated with the COX pathway? Is it not associated with that? If it is, you can try different agents that approach the cyclooxygenase pathway that are over the counter. I deal with children on the spectrum, so as some of you may surmise, these children are extraordinarily sensitive. I mean, they react to everything. And I didn't become a doctor with all these kind of weird things because I like doing it. The children simply don't tolerate over-the-counter prescription meds very well. And that even medications that are designed for autism, of which there are really none, but there are 2 FDA-approved agents right now for autism to address irritability. That's it. And they respond poorly to those as well, usually. Okay, so I think the details of what kind of neuroinflammation you're dealing with. I mean, I can throw out generic things for you to try, but I think that would be a little bit jumping through hoops that are, probably not appropriate. And we can talk a little more later if you'd like, and I can find a little bit more detail of the nature of your question. And there are many answers to your question.
And have you looked at the work at all of Martin Blake? I think it's pretty sure it's Blake from the CDC, Missing Microbes. I was curious about all the microbes, whether they be viruses or bacteria, that seem to be implicated in terms of increasing risk. And yet he would say that it's actually our treatment of these microbes that are increasing the risk. And then the other aspect is the cesarean rate, as the fact that the children who are born of cesarean actually have the microbes in their skin and gut of the surgical room and not of their mother.
Mm-hmm. So this is a whole topic in of itself, and the reality is a robust amount of research has been done on this in autism and outside of autism. William Parker at Duke is doing phenomenal work on this. Rob Knight is doing work. I think he's in California. I was telling the other family here. The bottom line is that what has been documented in autism is that children have a lack of certain bacteria. They have an imbalance of the firmicutes and bacteroidetes. They have unusual bacteria, so sulfobacteria inside. They have a questionable amount of yeast growth or overgrowth. And the question is, of course, is there any one pattern that fits the vast majority, and there does not seem to be one. The C-section issue is a topic in of itself, and I believe that anytime I see a child with C-section, I want to hop on them immediately. I want to hop on them. I was talking with this other family about, sorry to get really graphic here, about stool transplants, about the use of probiotics versus stool transplants versus the newborn cocktail and vaginal fluid being put into the oral pharynx of young infants. These are all issues. I'm not doing it right now, but I mean, I'm telling you that I have to make my parents aware. And I'll tell you why. Because the ability for us to be able to recolonize the human gut as adults is still not documented with robust success. I don't believe that it's necessarily impossible, but I think one thing that's becoming more evident is that if we allow things in situ, in their element, whether it be the fluids we were talking about and the secretions, to be put into a gut, as we all know, many of us know, the shocking success of curing Clostridium difficile infections with stool transplants was completely unexpected, and it's over 95%. That's almost unheard of in medicine. We just don't talk about that C word. It's a 4-letter word. We don't use that word in our profession, right? So I think that there's something to that, and it needs further investigation. And even as I talk to you now, I'm in conference with laboratories to find assays to do that. So, yes.
Any other questions?
If a woman wanted to reproduce,
Mm-hmm.
is there a retreat or an ideal place that she would go to and take care of your multiple problems?
You mean to have her baby, or to learn about this, or to have her baby? I mean, to conceive.
To conceive.
Okay, I didn't want to. I don't know who you are, but you seem to know. I don't know of any ideal places. I'm sorry. You could go somewhere that is, you know. I will say this. I think that if you look at all we talked about and scaffold your risk factors, I would hope that whatever happens with a woman and her body is one in which stress is minimized, infection is kept at bay, and optimal nutritional status is provided. So if you can meet those criteria, I think that you're probably in better shape than the average person who has open windows by the highway and is stressed out and is financially and emotionally and relationally and stressed, and then didn't know they were going to have a child, and they do. Yes?
As a bowel biologist, there's a lot that can be done in the maternal environment and preconception. I have a 29-year-old daughter. She's already cleaning herself, getting rid of these poisons. 20% of American women of childbirthing age have enough mercury in them to cause fetal brain damage, just that alone. And so there's a lot that can be done there in advance, but there's also a lot that can be done in her environment to keep it that way while she's pregnant. There's just a whole lot that can be done that is, whether it be dealing with radiation, which is I consider it a pretty major factor, or the nutrition or the methylation, or using air purifiers so that like good air purifiers. You know, a lot of the factors can be mitigated, but it takes education, awareness, and some bucks.
My practice, I'm a pediatrician, as you heard, but my practice, I'm trying to move it steadily toward taking care of women. I don't like women. They're so complicated. Okay, I know nothing personal, seriously. But I mean, medically, it is a very different issue than men. And I really didn't want to get into, taking care of women. I chose to be a pediatrician. But the only way we are really going to hit this thing, in my personal opinion, is prevention. And the problem is, of all the slides I showed you, there's nothing in prevention. And we have got to work from preconception through the 4 other phases to help these women and their babies and the men. And the men need help too. We're a mess. But I'm just saying that I really believe that, I will continue to take care of the kids, but we've really got to start focusing on prevention. All right.
All right. So,
Thank you.
Thank you.